Well, welcome everybody. Great to see everyone. It's been a beautiful summer. We'd like it to continue.
Started in September, our beautiful summer.
Well, the grass is still green, so I'm happy about that. Usually now it's like brown and really crunchy, but it's still green pretty much. Yep.
I know.
Summer is finally here.
Yep.
It's been a fun summer and it's so nice to be back at it, to be honest with you, to know that we've got our lineup coming with the RDH, some great guests today. It's really nice to kind of be back to routines. I love the summer months. Honestly, I do. And this summer, I took a lot of time just to be quiet and try to be present with my kids. I'm like, but let me tell you, September hit like with the bang. It was like, okay, we are back in it and we are in it to win it. Let's just keep going, guys.
Yeah, it's good to get back into the routine.
I agree.
Everyone thrives on a routine. Yeah. And now we're all trying to fit more things into that routine, new things, which we're going to talk about today that we need to fit into the routine, right?
Fitting it, understanding why we need to do it because it will make it more efficient. I think that's funny. Before we went live, everyone, we were talking about efficiency and trying to be efficient with different things and learning from all of our different connections that way. And I think that today's show, you guys are going to walk away with quite a few nuggets of great ways to implement this, the reasons why, because this is such a great topic to discuss, honestly.
I'm excited.
I am too.
I am too.
Well, we are now, yes, thanks for being here. We are live now on Facebook, and it looks like we've got lots of people joining us, still some people coming in, but I think we can go ahead and get started.
Should we start just by wishing a lovely Liisa Hardill a happy birthday?
We should.
I think so.
Thank
Kath,
you.
do you have maybe a little song prepared?
I'm embarrass myself. I'll just do the end. Happy birthday to you. Cha cha cha.
Thank you so much, ladies. That's very sweet of you. Really appreciate it.
Thank you for being here with us on your birthday.
My pleasure. Where else would I be? This is exciting and so pleased to just spend some time with all of you.
Thank you.
All right. Well, thank you so much for being here, both of you. We've got two Liisas today as our very special guests. So I'm going to share a little bit about who they are and kind of what they do in this dental space. But before we do that, just a little bit of housekeeping as usual. This is being recorded. So if anybody has to hop off early, you'll be able to watch a replay. If you've registered through Zoom, then this will be automatically uploaded into your personal portal. If you have any trouble accessing your personal portal or you can't remember how to do that, just send us an email at info@rdhu.ca and we'll be able to help you out with that. If you are joining with Facebook Live and you want access to a portal, again, just give us an email if you're having any trouble accessing the recording. And in your personal portals, those CE certificates or access to the CE certificates will be provided as well. We have a big group coming with us. So we're going to try our very, very best to get to all the questions that come in through the chat. Just to help us systematize the questions, instead of using the chat to ask a question, if you could use that Q&A function for us, that'll just help us to be a little bit more on top of things as we go through. Sometimes things get a little bit lost as the chat grows. So thank you for that. We can't hear you and we can't see you. So hopefully you are all somewhere and you're just relaxed, have a nice hot coffee or a tea, and you can just sort of take all of this in, but please do communicate with us by the chat or questions in the Q&A. So I have the absolute honor of introducing both of our guests today. So I'm just going to share a little bit about both of them. We have Liisa Hardill and we have Liisa Moore. So one Liisa has two I's in her name and the other one with one. So that's how you'll be able to distinguish between the two. So the first one is Liisa with one I, Liisa Hardill. And as a registered dental hygienist since 2003, Liisa has worked in private practice, public health, and independent practice. It was in 2017 that she began getting involved outside the operatory in dental sales and consulting-focused integration of preventative products, practice growth strategies, implants, biomaterial, and digital dentistry, all leading to her current role focusing on clinical development with Dental Corp. This role focused focuses on continuous learning and opportunities to support dental professionals with best practice protocols encompassing both dental hygiene care and 3D scanning and clear aligner therapy. Her purpose continues to thrive with motivating, inspiring, and supporting fellow dental professionals to love what they do, share the benefits of ongoing learning and awareness of services that can have a huge impact on the quality of life and overall health. Liisa also shares her perspective on her current dental hygiene topics in a personal blog, which is found at strictlydentalpro.com. And you can also follow her at strictly.dentalpro. So thank you, Liisa Hardill, for being here with us. And now I'll introduce Liisa Moore. So Liisa Moore graduated dental hygiene in 2006 from Canada College. After graduation, she returned to her hometown of Sudbury and began her dental hygiene career working for a local orthodontist. Throughout her career, Liisa expanded her skills, working as a temp in general practice, in an oral surgery office, as an educator, and even owned her own clinic. While gaining valuable experience in other specialties, Liisa always kept her hand in orthodontics, as this is her true passion in the dental hygiene scope. Liisa is also RDHU's orthodontic trainer, so she's brought one of our dreams at RDHU to fruition, and she's now offering ortho fundamentals, advanced ortho, and a scanner and aligner therapy course. So Liisa, thank you for doing that, because we've been wanting that forever. When Lisa's not in the office, she enjoys spending time with her husband and 2 children. So thank you both so much for taking the time to be here with us today.
Thank you for having us. And honestly, this has been a wonderful opportunity to be part of, and to even have met Liisa through this opportunity, and just to be able to connect with her and see all of you. This is great. So thrilled to be here. And again, thank you for the opportunity.
All right.
Yes, thank you very much. Super proud to be our team RDHU, and I just love being down there and sharing all my experiences with you guys. And I just love it. So thank you for having me. I really appreciate it.
Awesome. Well, we're all just so happy to have you as friends, colleagues, and guests today. So just to sort of start off the conversation today, I was just hoping that either both of you or one of you, just wondering, how do you see technology influencing innovation in the ortho space specifically?
I know here in the ortho office, where I currently sit, I'm coming at you live from the lab today. It's obviously a non-clinic day, but anyways, the digital scanning has been huge. We got our first scanner in 2016. And we've been using it ever since. We have 3 now in our clinic. So we have 6 chairs in our clinic, and we have 3 iTero scanners. And I remember when we went to a course, this was quite a few years ago, we only had 1 scanner, and one of the speakers presented and said that someday every dental office, there'll be a scanner for every chair. And we used to tease our boss all the time, like, oh, a scanner for every chair. And he just laughs. So now we have 6 chairs and we're up to 3 scanners. So we're hoping to get 3 more, hopefully. But it's really influenced the ortho space. I mean, the biggest thing is that there's no more goop. We don't take impressions anymore. We have a lab fully equipped with 3D printers. So every appliance, every retainer, it's all made here in-house. You get way more cooperation, especially from the little ones. It's a lot more fun to have a scan taken, and they can actually watch their teeth appear on the screen as opposed to the goopy stuff in the tray. So you get way more patient cooperation. The smile simulator is huge. After the scan is done, you can see a before and after of what your teeth could potentially look like after you're done treatment, which really increases case acceptance as well. I feel like a lot of parents come in and, or even patients in general, they say, like, what are your concerns? And they say, oh, the dentist just sent me here. I don't know why we're here. And, my kid has straight teeth. What's the big deal? But then when they see that before and after, or you can, manipulate the scan and show them the big overjet or overbite, or, it's a way more of an eye opener for the parent and the patient themselves to say, oh, wow, like my teeth could look like that. It's huge for case acceptance. And even I think the technology allowing it's accessibility. Like where I am, I'm in Sudbury. For those of you that aren't familiar, I'm about 4 hours north of Toronto. So, and then there's communities even further north from where I am, where orthodontists, it's remote, and with the digital scanning now, with things like clear aligners, the patients only have to travel once every, 10, 12 weeks to get more aligners, as opposed to every 4, 6, 8 weeks with traditional ortho. They can be monitored remotely with apps and photos and things like that. So I see that's kind of where I see technology leading in ortho, just in my career.
Yeah, no, I think I can definitely, hear and see a lot of those things that you just spoke to, Liisa. I think too, if we just look at even the capabilities of something like clear aligners over the years, like it's just, patients really now of, different ages, right? There's the capabilities to kind of intervene, more so like early interceptive, that like phase 1, really looking at even kids, right? Mixed dentition that are growing. So, I mean, I think there was definitely time not too long ago where it was very much for like that certain type of patient, right? So the capabilities really, really growing. And I think the technology and the innovation really, like you spoke to, the access. So there's a lot more GPs that have been able to build comfort and confidence in offering something like ortho with clear aligner therapy, because of the technology supporting, what they're doing, and a lot of the training, and, getting into those cases that maybe aren't as complex, that obviously, ortho or those with more experience and education would kind of focus on. But I'd say that's a big one. And, you really touched on it too, like the tracking, right? When cases aren't tracking as intended, it's amazing now how dental professionals can intervene earlier, right? They're monitoring through the virtual care AI. There's these automatic assessments and photos that patients can just take and upload. So the convenience of what the innovation is doing is huge for the patient experience and access, and obviously for hygiene, compliance, right? We want to know, like, if there's issues with not just wearing clear aligners, but like home care, concerns with the tissue, and what's going on with hard and soft tissue. Again, compliance and that regular kind of monitoring and motivation for patients is really important. So yeah.
I'm excited with what Liisa, well, with both Liisas, what they've said, but as far as like teledentistry, it really is bringing access to people that don't have that access, or there's ways to make it easy. And we know the easier it is for patients, the easier it is for clinicians, the more likely they are to adapt it and to go with it. And I think that teledentistry, the role in so many different ways, and utilizing the AI technology, that really has been a huge asset for my patients. And as you guys really nailed it, it's just such a great opportunity.
Liisa, Hardill, you mentioned the case acceptance, case compliance. Do you find that because they are able to see visually sort of where they are right now and potentially where they could be if they follow through with the treatment, do you feel like it's actually increasing their level of motivation because now they know exactly what they're kind of striving for and what could be the result if they are in fact compliant?
Yeah, I mean, I think we can go back to like a picture is worth 1,000 words, right? And the education and the understanding, the big part is the understanding, the imaging, the 3D imaging, a lot of the applications that are patient facing, it's allowing them to really understand where they are, what is, some of the impacts of malocclusion or traumatic occlusion. So for sure, it really engages the patient in a whole other way, for sure.
Going off on that just a little bit, it's been very interesting to me in the past year. I have had 2 80-year-old women for different reasons. Their bone, their TMJ, they present with TMJ pain, and they have a deteriorating, continuing to incline teeth, and so now, because of digital scanning, we're able to explain that if we uprighted and supported things better, you wouldn't have this pain. And so this whole ability to be able to use the scanner and then show how that pain that they're feeling could be removed by changing their vertical dimension and changing their bite load. That is amazing to be able to put that thought, and then for them to realize this could fix it. And so one of my elderly ladies, she's now pain-free, and she's so excited, and she's only part way through her treatment, but she can feel the difference in her vertical support. And so, but not being in pain is fantastic. So please tell us, what are some of the unique patient facing and provider tools of the 3D scanning that elevates our client care, besides not having to have alginates
Yeah.
and ganglies and all those other great things.
And I love that story about, I mean, again, it's not driven by just aesthetic dentistry. It's like functional, right? Like there's so much that, again, patients of all ages need to like understand, okay, this is the current state. And, you know, these are the potential issues, problematic situation that's going on. These are the solutions, right? That we can then bring into the conversation and treatment planning of patients of all ages, right? It's not just like the older elderly, for sure. I mean, there's definitely a time and a place where taking their teeth out of trauma, and those maybe teeth that are more lingually inclined, upright in them, like you said, it can make a huge difference. But if we're talking kind of specific patient-facing, you know, applications that some of these 3D scanners can utilize, for sure, a big one is really understanding the bite, right? A patient, when they're coming in and a dental professional seeing, you know, thinning, chipping, wearing of teeth, I mean, it's very hard for patients, especially in the posterior, to sometimes visualize that, right? So even thinking of like a tool like the occlusogram with a scanner like the iTero, it's actually showing like color mapping, where very powerful for a patient to then see, you know, how are my upper and lower jaw or my upper and lower teeth coming together? Where is there kind of premature contact happening, where again, that's risk for recession, abfraction, continued wear, right? That ultimately can impact their teeth long-term, like the health of them, right? The same way periodontal disease and dental caries can, right? So important for them to see that. And with the color mapping, it's again, much more, I think, evident to, let's say, the patient. There's also some tools with like even, you know, scanners like the Trios, where it's like patient monitoring, or iTero calls it time lapse, where you can take 2 scans over a period of time and you can actually track changes now, right? With hard and soft tissue changes, things that the human eye cannot see, or definitely that the patient is not able to see the same way that a dental professional can, with the light and the loops and you know, above and beyond what scanning can show as far as like the accuracy and the detail. So time lapse, patient monitoring, really being super proactive, where this is something where they can then see the changes happening at a level where, again, intervention or understanding can happen so much earlier, right? That's a big piece. And then I would say, Lisa mentioned it earlier, like the simulation, those applications with the simulation are very motivating, because a patient, you know, they see their teeth the way they are now on a screen. And when you can create that auto or outcome simulation where, you know, within seconds, they could see the teeth out of trauma, the teeth aligned, and truly understand like what the outcome of treatment could be, very motivating for a patient as well. But yeah, Lisa, what do you think as far as other apps or patient facing things with the scanners? I'm trying to think.
The scan, like you said, the comparison is probably by far the biggest one, because again, too, like we said, ortho's not just for teenagers anymore. We get so many, like you touched on the phase 1 treatment. Our youngest, I believe, patient or client to date that we treat with Invisalign was 7. And I think we all had our doubts a little bit, but it was a little girl and she was a superstar. She had a little phase 1 with Invisalign, and yeah, 7 years old. It was, yeah, and she rocked it and she got a beautiful result. So it really is for all age groups. But so many times too, that scanning is part of our new patient consult now. All of our new patients get a scan, and it's again too that smile simulator. And so many times, like I said, the parent comes back and they see the result that their child's going to get, and they're going, I kind of want that done for me. And then they're booking on their way out for their new patient because they want to see what theirs are going to look like too, you know. And it's the smile simulator for sure. And I mean, it's just a great tool. Like in our office, the doctor, like he would do a new patient exam and then he would actually physically show the parent in the child's mouth. But Lisa, you touched on it, you know, not that they don't know what they're looking at, but it's hard to see when you're looking in a 9-year-old's mouth with a mouth mirror and the light's not great and they don't have loops on. But when it's on a screen on a digital scanner, and you can actually point out, well, see, this is a cross bite, you know, and you can actually, they can see it, or a deep bite or an impinging bite. And I always laugh because I like to say, I spin it around and I show them what their tongue sees, because you can manipulate the model and turn it right around, and you can see those lower incisors hitting the palate when you can look at it from that aspect, right? But you'd never be able to see that just looking in the patient's mouth or your child's mouth, right? So just that viewer is even just a game changer.
I love the scanner because I feel like it's not Carrie telling them, it's Carrie showing them. And I feel like that in itself is one of the unique opportunities for implementing it. So I am pro scanner. I love it. It's like we should be all doing it. But now that we have some really great experts on this call, I'd love to know your insight, because the burning question from hygiene is always like, how do I fit it in? What kind of appointment should it go in? You know, how do I have to prioritize this over something else? And I have my own version, but I'd love to hear from both of you kind of how you can help guide us, because it's the how to. Everybody believes in the technology, like they know that this is going to make a difference, but what tidbits can you take to listeners so then they can identify maybe the appointment sequence or where they can fit it in, and two, you know, why, maybe that additional why factor.
Yeah, and I think if we all just really stop and think about, you know, like the communication is really like at the forefront of everything we're trying to do with patients when they're in the op, right? They're there to truly understand what's going on with their current oral health status. So, you know, engaging patients in more of a dialogue, that is what the 3D scan is going to do. And in many cases, it's going to create, and I'm sure we've all experienced this, a situation where the patient is there's actually less words that may be required or less explanation when an image is supporting a conversation with a patient, right? So it gets the patient more engaged in more of that dialogue versus like a dental professional, like a hygienist, just explaining and talking to them about what they're seeing, right? So as soon as they're engaged, they're seeing, they're asking questions, it definitely opens up the door for them to explore different treatment options when they're seeing things right on the screen. But ultimately, I think we all need to truly look at the fact that, you know, this is the best way we're going to create a record for our patient, right? A 3D scan, just from a records perspective, is probably the best we can offer our patients, again, to understand their current state, but then also just monitor for potential changes. When patients understand, okay, it's a digital practice, this is part of our record keeping, that's, you know, a big part of what we want to ensure our patients understand, because again, they're going to embrace it, and it's also going to just elevate their experience that they're in this type of practice that does digital record keeping. I would say as far as the type of appointments, you know, as hygienists, we're constantly looking at, you know, we're doing our intraoral assessment before we dive in there, extraoral, intraoral, you know, as soon as we're seeing those patients with things like clefting, lingual inclination of teeth, abfraction, recession, wear, like those are the patients. I mean, there's a whole other subset of patients for sure to scan, but those are the ones that are showing signs of occlusal trauma. These are the patients that we want to prioritize scanning. You know, we all have those kind of scale only appointments where maybe a patient is booked in, they're not due for radiographs, they're not due maybe for perio charting or an exam. Hopefully there's a few extra minutes, right? When dental professionals really have that opportunity to train and build their comfort on the scanning, it does take a couple minutes, right? Let's say 5 minutes, sometimes a little longer, even sometimes a little shorter. And I can honestly speak with, you know, personal experience. I think, you know, once you give it that chance to kind of really embrace the scanning, it's like anything we do. The more you do it, the faster you get at it. So it's looking at, you know, those type of patients, the type of appointments that make sense. You know, we all start our day with like, you know, auditing or like prepping, looking at our flow of patients. Okay, where does it make sense? Yeah, this patient, this time of the day, understand where the scanner is going to be. I know a lot of practices where they have an iTero column. So that hygienist is going to know where that scanner is, whether it's an iTero, a Trios, whatever the brand is that they have within their practice, they know where it is, and it opens the door for them to then utilize it in a way where they're not looking for it. And again, it's got to be simple for them, right? So prep is part of it. And I know Liisa mentioned it too, like those comprehensives that maybe are being done on whatever routine basis for certain patients based on needs. Those more formal kind of assessments, new patient exams for sure, but definitely hygiene visits. It's possible and it's so powerful and can truly help them as a dental hygienist get their patient to understand what's going on. So it aids in like efficiency that way, right? When they're just understanding and there's not as much explanation that goes into explaining something like recession or wear or abfraction, right?
Can I just unpack a few things that I think there's some nuggets that I took away, even language, because it all comes down to communication and language. And the fact that you put, and it is the iTero into the digital record keeping protocol, like to me, when you highlight that, they're like, oh, they're so different. And it's just a different way of explaining it. And I'm like, that's the word language I want to use. And how you identified, like looking at your day, like if you've got to do perichart, you've got to do bite wings, maybe try not to fit that in then. But there are scale only appointments. There are opportunities to do that. And, you know, looking at that abfraction, wear, recession, I love pulling that out when I've got a perichart. I'm like, hey, you know, we've been monitoring these. So you don't want to do anything. Let me show you what I see. And it's like, oh, well, that doesn't look so good. It starts that conversation and it goes through it. So I really think that was really great. And you keep coming back to being prepared. So the idea of having a column or somehow identifying who needs a scan so then your whole team knows makes it easier. So you're not running around looking for it. And until everybody can have their own scanner in the office, which I'd love to have at Unicorn office. If you have one and you're applying, there's a job opening, let me know. I will maybe applying if it's reasonable to Port Perry, let me know. But you know, these things make it more efficient and make it easier. The other thing we do in our practice is we actually put a code in, a dummy code, so we know when the last scan was done. So it's an easy way to track it that way. But anyway, so I had to unpack what you said. Liisa, what other insights can you give us?
I love what you said, Carrie, about this isn't Carrie telling you, it's Carrie showing you. And because that is just, like I said, that's so huge for patients when they can actually, see what is happening. In the ortho world, like I said, we scan every single new patient. Hygiene's a different ballgame in the ortho world. It's not quite like, again, the appointments are all different. So we scan at the initial appointment, obviously. If they don't, for some reason, get a scan at the new patient exam, or say it's a child and they're not quite ready for treatment and we see them 6, 8, 10, 12 months later, again, the scanning is part of their initial records. So that's when we use our scanner. And then of course, for every time we debond, take braces off, because every appliance, every retainer, every clear aligner treatment, we're always scanning. And it takes practice. Like Liisa said, like anything else. I remember the first time, I think it took me 20 minutes to do a scan, and it was on one of my colleagues that had perfectly straight teeth. So it was easy. It was an easy scan and it took about 20 minutes. Now I get them done in probably 3 minutes a patient, sometimes a little less, sometimes a little more. Edentulous is a little bit harder when there's missing teeth, or like I said, if they're really malaligned, which like initial scans are, they're a little trickier. But yeah, the more you do it, the better you get at it, right? I mean, I'm sure none of us were perfect the first time we picked up a Cavitron or Prophy or fluoride, any of those things, right? And the scanner, it's fun to learn on too. So if you're not comfortable with it, like that's the best place to start is with your coworkers, right?
Yeah.
Get a colleague in the chair and practice away. And if it, like I said, it took me probably about an easy 20 minutes for the first time, but it's.
The first person I ever scanned was myself because I wanted to know what it felt like. And I was like, oh, that hurts. Oh, that's not the right spot. I was like, ooh, okay, let's not do that on my patient. So, you know, find a good friend, or even think about, you know, the positioning. It was like, I got to realize where I need to move their jaw or how everything needs to be aligned. But yeah, no, even try it on yourself. Just, you know, be kind to yourself.
Yeah, I think that's really good advice. And Liisa, when you were talking about how initially it took you 20 minutes and then you got so fast at it, when you have people either applying to the practice or, you know, other Liisa too, when you're going from clinic to clinic, do you find that people who are new to the team, is it something that they're initially very intimidated by, or are you noticing a shift that people, even if they haven't used it, there's this excitement to, like, how are you finding people who have no experience with these scanners? Like, what's their reaction when they're in these practices that have them?
Liisa, you want me to take?
Oh, go ahead.
No, well, we'll both share our thoughts. I'm just thinking, I would say it's really mixed, right? The excitement is for sure there. But I would also say, depending on where they are in their career, there might be a lot of other things they're still trying to really grasp and build comfort and confidence around, right? Let's say a newer grad. But again, I've encountered some new grads that are really excited to kind of jump in and make that part of their workflow. And others where, yeah, it takes some time. It can be a little bit intimidating, but if they take the steps to really train and build that confidence, again, start, as Carrie said, scan yourself, scan a colleague, pick those easier patients when it makes sense in the schedule. They will get there, and they will then see this as a tool that at the end of the day is super, it's benefiting the patient care. And ultimately, as a dental hygienist, that's, the communication, them understanding things is really at the forefront of everything that they're doing. So that's where it's really embraced. I mean, I've seen practices go from, again, on the like they'll scan restoratively, but I'm just talking like educational scanning, go from, let's say 30, 40 to like close to 100 scans a month, right? Where everyone, like, it's a full team effort to utilize the scanner, elevate that patient experience, patient education, and then ultimately open the door to, treatment that this patient may require, whether it be a night guard or, aligning the teeth or anything else that kind of comes out of these really powerful discussions, right?
How often are you, like when you're in a general practice, how often are you scanning a client?
I would say every 6 months, once a year.
Okay.
Yep. For some patients, it could be a little longer. Maybe you'd want shorter timelines. Again, if you're monitoring certain areas.
Mhm.
But yeah, especially if they're using something like time lapse, where you're taking the 2 scans and really seeing any sort of change that has happened within a period of time. Yeah, typically that year, that 18 months, that's where, you're giving it that amount of time where if there is changes, you're going to notice it within that time frame.
And here at RDH, we get a lot of inquiries about training for scanning. So that's why now Liisa Moore has created the scanning hands-on program that's next month. So I'll talk a little bit about, or I have a little video to show you afterwards about that. But like when I think about the 3D scanning technology, like how has that helped with the dental hygienists improve their workflow and efficiencies in their practice once they get the hang of it?
I mean, once they get the hang of it, I feel like for sure we've definitely touched on so many things that are impacting the workflow and the efficiencies on just the whole patient appointment, patient interaction. I think even if we look at an example of, a workflow where your dentist is coming in to do the exam, like to have that handoff where you're kind of, informing the dentist of what the findings were, to have that image, have something like a 3D image up on the screen. That handoff can be really smooth, and the dentist is now able to very clearly see what you saw, what the patient has now saw. So it's a more collaborative discussion, right? When you have that more impactful collaborative discussion driven by an image, I mean, that's where, again, for sure, I think it speaks to the efficiency side, but also just the impact that it's having on the patient understanding, for sure. The big thing too is with, like, hygienists love before and afters, right? Whether it's even using like intraoral camera, a lot of scanners have built-in intraoral camera capabilities, right? Where again, you're just using these images of showing like, here's before, here's after, even something like, following their dental hygiene services that are being provided in regards to removal of some hard and soft deposit, right? So utilizing it that way, I think from a workflow before and after is pretty key. And then also looking at, again, I can't say it enough, I hear this time and time again, where an image can actually really help with the conversation, make it not just more impactful, but more efficient, in the sense that the patient's getting it, or they're not, well, what do you mean by that? Or, well, like, what was it, all those questions that patients ask, we want to be able to address them, but then it, can take up more time within the appointment, which can be tricky, right? For a dental hygienist to balance that, ensuring they're informed, ready to make maybe potential decisions on treatment, but also not taking up like half the appointment, right? So
It really seems to catapult the whole appointment forward when you have that available. The introductory portion is done already, and you're really getting to the direct into the issue, which then makes far more use of our time. Sorry, Karen.
No, I was just going to say, I'm like, I think sometimes as a dental hygienist, and I've worked in ortho and I work in general and all the rest, but we get so caught up in, well, this is what was scheduled for today. And it goes back to that assessment phase. So I know I'm echoing, I'm like, Anna Louise, I know you're probably going to jump in here too. It's like, we really need to make sure we're properly assessing that patient. And maybe that scan revealed something different. So yes, that might lead us in a different conversation that we have to change our treatment plan and come up with the right dental hygiene diagnosis. And we have to treat those risks that patient has. We can't just stay on the same path because it's not a calculus disease. It's a biofilm, it's an infection, it's all these other things. And this is one of the best tools, I feel like, that really helps the dental community and helps with that conversation. And the fact that in different scenarios, I've used many different scanners, it just is such a great way to have that conversation to go forward. So anyways, yes, and the record keeping part, the once every 6 months, 12 months, if there's somewhere that you're watching and you're trying to get that patient to know that they need to see a perio or need to see an ortho, it's like, well, let's keep scanning, let's keep showing you. They keep seeing it or they see it progressively get worse. It's like, oh, okay, now is it too late? Never too late to start treatment. Let's just start that conversation. So, I really think that it's something that we need to go forth with for sure.
That's great, Carrie.
Just touching, sorry, Carrie.
No, go ahead. No, Liisa,
just touching on the whole efficiency thing. Again, ortho's my game, so I can't help but bring up, and I hate bringing up alginate again all the time, but holy, game changer, you're not measuring, you're not mixing, you're not taking impressions, and then just infection control, right? We don't have to spray the impression. You don't have the trays. You don't have the pour up. And like I said, I'm in the lab right now, and the difference in here is huge. There's no stone pour ups. There's no grinding. There's no, even from a safety standpoint, those grinders
environmentally friendly.
Yeah.
Environmentally friendly, cost savings. Yeah, so much.
It's huge, and even it's just from storage, you have to store them for 10 years or 10 years after they turn 18, these models, right? And it's like, it's crazy. Now everything's digital, it's just for efficiency. In ortho, they've been just game changers.
In the cloud.
Yeah.
In the cloud. And I laughed just going back to what Beth mentioned earlier about the excitement versus hesitation. I feel like we have a pretty good office here. We don't have a huge turnover. We have had a few new staff members join us. And I feel like it's more, I do have to, from a staff point of view, from a clinician point of view, I feel it's more excitement. The only reason I'm bringing this up is it's kind of funny because I feel like the only hesitation that people have using the scanners is that they are very expensive. So I feel like when people first start, and especially because we have the iTero, and I'm sure most of the brands they're on wheels, right? So you wheel them. Like I mentioned, we have 6 chairs in our clinic and we have 3 iTeros. So you're wheeling them from chair to chair, right? And I feel like that's the only hesitation that new team members have had with using them, is that they're almost scared to move them because they are so expensive.
Very good point.
That's very timely that you brought that up. We just had a question come in just wanting some advice on how do they get their dentist on board in getting kind of every hygiene operatory outfitted with a digital scanner because of the cost. So any insight you could provide?
Well, that's right. There's a good suggestion, is that they don't have to worry about moving them, right? Because especially I know one office that it was a podcast I was listening to, there was a little step up. And the rule in the office was that the scanner did not go up the step without 2 people carrying it to lift it up. Because again, they're an investment. They are a huge investment. So that's kind of the point right there, is depending if you have a multi-level office or different types of flooring, even, just for your investment, you protect it. It stays in that one room and it doesn't go anywhere other than around the operator, the clinician chair, or the client chair. Sorry, you're not having to worry about transporting them.
I believe, as again, when we go back to innovation, things like even like the NERI or the caries detection, I believe they're going to start to be really viewed at as, whether it's like the standard of care, but as it's further embraced, and just, even if we look to 5 years ago, there's so many more practices that have invested in more than one scanner. So we're probably going to eventually head that direction, right? It's just, looking at all the benefits that it provides within the practice and within each provider, having it at their fingertips. That's where the opportunity to actually utilize it is going to obviously increase, right?
And
I think sorry, go ahead.
It's like with anything that we want to implement into our practice. And I have so many worksheets that, for implementing lasers into your practice, implementing an instrumentation program into your practice. So it's like with anything like this is like, you want to have that sheet, right? Do the status quo, like document status quo. Where are we at right now? What are the pros and cons of our status quo, and where can we take the practice? And then really show all the benefits, like the efficiencies, the workflow, the case acceptance, the motivation, the home care, all that stuff. You just put that on the other side and you show that, right? So you do your research and you present it like a case presentation to the dentist with the costs and everything, and what's the ROI. And so once you have that, you just don't go up and say, I think you should get a scanner, right? You have to be prepared and take the information and, call somebody, call Liisa, do anything that you can do to get the information to really put that down on paper and then present it to the practice.
That's what I was going to say. We needed a business case. So you did it much more eloquently than I did. And, looking at the number of patients, and I think back to Liisa's point, as far as having a column and identifying where that scanner is going to be. So if you only have one, show the doctor how it can work and show the doctor the benefits that can come from it. And, we discussed a crown, we discussed a night card, all of these treatment plans were closed because I could really easily demonstrate and have that conversation with the patient. And I think that has been helpful. There've been many patients in our practice that we've scanned, and it's like, I'm not ready for the night guard or what have you. And it's like, they call us back 2 weeks later, like, the doctor checks it. Yep, we're good. We'll send it off. You can utilize that to save an appointment. So there's lots of ways to get creative, but as Beth, you were Beth and you were Kath, as Kath said, creating a plan and keeping things organized, I think, is your best bet to move forward for sure. Anna Louise, do you have anything else to add from your experience from using it?
No, I think you're hitting on all the big points. I'm just like thrilled that it's part of it's growing, right? And we're in, I've been around way too long in hygiene, and the evolution of care is phenomenal, right? And it's the speed of which it has been changing over the past, let's say, decade has been astronomical as well. And this is going to be the regular part of practice very shortly. And we'll look at things like alginate and gagging and, having people throw up on you as part of the past. Thank goodness. Right.
Thank goodness.
And so once we make, fluoride varnish has been revolutionary for that as well. And so, we're going to make positive experiences be, the norm, rather than having any of these negative things that people experienced in the past. Like when I think about the way I had fluoride, or the way I had multiple sets of orthodontic treatment plans because of my cleft. And so everything has been changing and moving forward, all for the best.
And it's also one of those things too, that if you're not implementing this into your practice, you look like you're kind of staying in the past, right? And people talk, they'll share their experiences even at dinner parties, and this is what happened. And it's like, oh, well, we don't have that at our practice. It's like, you really have to keep current, just to keep growing.
So that leads me to a really good question. Okay, so trends. We love TikTok because it is trendy and people do all sorts of great things, okay? I do not recommend putting elastics to close diastemas, okay? Breathe deeply. It's okay, Lisa Moore. It's okay. So what are some of the things that you guys are seeing in trends when it comes to ortho and hygiene? And, what are some of the ways that this technology can also help with those trends?
Definitely. Definitely the main trend is the advancement of clear aligners. It's clear, and like even we touched on a little bit at the beginning, just the case complexity that clear aligners can treat now. Like when I first started, almost 20 years ago, 17 years ago, I worked for an orthodontist, and even he took limited cases for clear aligners because it was very restrictive, whereas now, like, it's pretty much anybody's a candidate. Like, I don't want to say anybody, but there are still limitations, but it's come so far in the complexity of treatment cases, treatment treatment plans, there we go, that clear aligners can actually treat. It's, you know, you can do surgical cases potentially up to the point of surgery with clear aligners. And like we mentioned, kids of all ages, as long as they're cooperative, of course. But the other, I feel like we're just we're relatively new to this in the office where I'm at, is we're transitioning to do some more digital bonding as well. Or like indirect bonding, which would mean like we take a scan at the initial appointment and then we send away to a company like 3M, or there's other companies that do it, and you get the custom trays. So instead of bonding the brackets to each individual little tooth, they all come custom made in a tray. You do a whole arch at a time. It's really cool. I have to admit, I was a little hesitant teaching this old dog a new trick, but it's really neat technology, and it's a little more workup on the orthodontist part, because they're doing a digital treatment plan, almost like a clear aligners case. But then when it comes to chair time in our office, how we work is we'll place the brackets and then the doctor comes and checks, and that eliminates that step because he's already checked them. He put them on, he knows they're perfect. He knows they're exactly where they want to be. So it's a lot less chair time. It's more comfortable for the patient because now they're not sitting there with a retractor and waiting for the doctor to come check the brackets. It's boom, boom, a whole arch, and they just tie them in. And once they're done, the doctor comes and checks before they leave. But the digital bonding is also becoming huge with the technology of the scanning. And yeah, in the clear aligners.
If I can just ask, you know, because this would be my part. If you're doing that digital bonding, then is there less material being used? Is there less, more precise application? So there's less flash, let's say, or, you know, and therefore, you know, for the client, they're going to be able to have better plaque control.
Mm-hmm. Yeah, it depends on the company that you use. We use two different companies. One, the brackets come preloaded, or sorry, they don't come preloaded. The brackets come pre-pasted and we load them in the trays. So that does significantly reduce the flash. The other company that we use, we paste them, which was a little bit of a learning curve, but I feel like now we know exactly how much. And I mean, I think that's a big, talking to the sales rep from these companies, the biggest kind of setback to that is shipping, to make sure that the paste stays soft and doesn't set. And it's temperature, right? Where I am, like you guys are all talking about how it's still summer down there, and there was people coming in puffer coats yesterday. It's not that cold where I am yet. It's still supposed to be like 20 degrees, but that's what the sales reps are saying is their biggest challenge is, you know, to ship it up here. Is it going to be okay in a truck if it's 40 below in the middle of January, right? So that's kind of there's still the little issues, but so that's why we do have to pay some of the brackets. But yeah, it does reduce flash as well.
Cool. That's great.
Mm-hmm.
I think too.
I have a good question. Sorry, there was a nice question that came in, and I feel like everything that the two of you have been talking about has sort of led to an answer for this question. But if somebody needed to put together or summarize to their practice owner why getting a scanner would be more beneficial than them simply having an intraoral camera, what would you say? Like, what are some of the top points that's why a scanner would be optimal, even if they have and operate the intraoral cameras?
Yeah, and I mean, for sure, there's some overlap when we're just talking about the power of an image, or having that more collaborative discussion based on, you know, the image that they're looking at with their patient, right? Whether it's with an intraoral camera or a scanner. But again, it goes back to the patient-facing applications. A lot of the things that, you know, a scanner can do is not necessarily, like, you're not going to get that next step with an intraoral photo, right? For sure, I think intraoral photos have been around for a long time, and now it's kind of like, again, leveling up in this whole new technology and innovative way of educating patients. And now it's a digital workflow, right? So you can actually, with a digital scanner, you can connect that to other digital equipment within your practice, whether that be, you know, a printer, a mill. So there's things that, you know, it's keeping up with the times as well, as Kathleen said, right? So patients talk, dental professionals talk, this is where we're at, right? 3D scanning is being really embraced. And when we look at the ROI, I mean, there's a lot of great tools online that let's say a company like Align or iTero puts out, where when you look at the savings on even something like, you know, final impression material, I didn't realize how expensive that stuff was, right? So you've got the restorative benefits of like eliminating final impression material, right? And then we talk about it from a records perspective and all these alginates. To me, there's so many things that are going to add up on the pro side when you're looking at, you know, why shift from not just having an intraoral camera, which is still going to serve its purpose, but also then leveling up and keeping up with all of the many additional benefits to intraoral scanning. And then what that opens the door to, right? It's going to open the door to keeping up to the future as digital workflow continues to expand and just become the way of the future for dentistry.
I just want to touch on what you said there, Liisa, too, about the flow and the efficiency and like the cost savings, right? So it's not just like, even from our point of view, again, I'm going back to the whole ortho realm, it's not just the cost of the alginate. Like anytime a client or a patient lost their retainer, right? The actual patient would have to come into the office, we'd have to take an alginate impression, right? And then we'd have to, so it's the alginate, the stone, right? But now it's also the time of that operator taking the impression, but it's also your headrest cover, your cavi wipe or your Optum wipe to clean the chair after. It's paying your assistant to clean that chair after, to flip it. You know, it's all of those things, those sundries, the bib, the bib chain, you know, it's all those little things that add up, that when you see 10 people a day that lost their retainer, that's 10 bibs, 10 clips, 10, you know, 10 air water tips, whatever you're using on the 10 headrest covers or chair covers. It's all those sundries that you're saving, because now I know in our office, when they get their braces off, we scan them, they come back later that day, they pick up their retainer and their model. We give them their 3D model and we say, you treat this like gold, because if you lose your retainer, this is all we need. And now we don't even need the actual patient, the client in the chair, mom, dad, boyfriend, sister, brother, whoever just drops it off at their convenience, leaves the model at the front desk. We make the retainer and then they come back and pick it up. And it's that chair time, which is huge cost savings. And now not only are you saving the cost of that patient in the chair, you're using that chair for somebody else as well. So now you have that chair time.
That's amazing.
That is such a good point. And right there is the argument to have them outfitted with all, like those are when you put it into those very, very practical terms, there's the argument. You won. You won the argument, Liisa.
I'm just so enjoying this conversation.
So can I ask you both, some as experts, and I know I've come up with my own clinical tips, but I know people that are using the scanner and are having some difficulty. Maybe they have a patient with a gold crown or an edentulous patient. What kind of tips or tricks can you suggest? Or is there a sequence of video that they can watch to help with some of these, not the perfect smile with everything perfect, that's great, but the patient that's a bit more challenging or has different missing teeth? How can you help them with the scanning journey?
Do you mind if I go first? I'll jump in here. My biggest tip is to make sure it's dry. So if you can't use an air water, like ideally you're using an air water syringe, the air. If not, you can use a 2x2, a cotton roll, like to get that field as dry as, even just to get them to swallow first, just to get that saliva out of their mouth, because that is a game changer. It just keeps everything really nice and like clean. You don't have to worry about going back, but yeah, dryness is key. And just make sure the tip is clean. I mean, obviously you're putting a brand new sleeve on every time you're using it. But it's true, those follow your manufacturer's instructions on how to clean the actual scanning head minus the tip, to make sure there's no streaks or smudges, because that really affects your scan quality.
What about Optrogate? Do you use that when you're scanning? Because I've heard that a lot of people like to use that.
I see that in some situations for sure, but even some of the sleeves, like some of the disposable tips that go over the head of the scanner, you know, some are reusable, some are a harder material that you have to sterilize, but the softer, more flexible one, like let's say, for example, on the iTero, that in itself is, you can use that as a retracting device. It's actually something where, you know, you can even push down a little bit on the soft tissue in that muco-gingival junction fold area. So it's, again, even going back to like skin, know how it feels, because then how you manipulate that around the mouth, you're going to know how that patient experiences, right, with just feeling that in their mouth. So that's a big one too. And yeah, knowing how the tip feels, again, even just how they're holding the scanner, right? Almost having like, some want to almost do like the death, like overhand versus like the pen grasp.
Mhm.
Again, there's automatically going to be, you don't want to be hovering. Hovering is another thing that can all of a sudden cause some lagging or not ideal scan technique. So how they're holding the wand, and really ensuring that they're not kind of hovering too much, that there's actually like the amount of space required to get that smooth scan happening, are definitely some things to keep top of mind. There's so much great training resources out there with like the companies that are distributing these scanners, whether that be online. Even a lot of the territory managers, they are dental professionals in some cases. I've met a ton of them where they have a ton of great tips and tricks where they can come in and sit with some new team members and go through some things, right? Even a lot of virtual like coaching and training opportunities with some companies. So look and see what's available to you as a practice, as a dental provider that has that scanner in your practice, because typically those companies where you've purchased or invested in this equipment, they want to ensure that you're comfortable using it, and that it's serving a purpose, right? So those are definitely a few things that come to mind.
And come to RDHU for training.
Yes, totally.
Yeah, come see me.
Right? This thing
Yeah.
coming.
Yeah, I was just going to say that helps to answer one of the questions that came in, looking for kind of options for training. And then, yes, of course, Liisa Moore next month is coming to RDHU for a hands-on course talking about just these things. So if you're looking for training, we would love to have you join us. I think we're just going to just to be mindful of the time and everyone's needing to get back to real life. Kathleen's going to, in a moment, just go over what we have going on at RDHU, what's coming up. But I just wanted to say thank you so much to both Liisas for being here. This was such a fun conversation. I feel like this has really generated a lot of interest. I feel like we could talk about this for a couple more hours. It's just really changing the way that we're doing dentistry. It's incredible.
Mm. Yes.
I can't believe how fast that hour went.
I know. So I'm going to share my screen and you guys let me know. Did I share the, I'm going to just do one more thing. Sorry. Make sure I click that. Yep.
Kat?
Yeah.
Stop it for 1 sec. Just want to switch your view there.
Oh, thanks.
You can see it a little larger, no problem. Perfect. Thank you.
One moment, please. I can't go back now, so I'm going to just okay. right. I thought that would be a little bit better than me saying what's coming up. Hope you
I
enjoy.
mean, I like both, but that was fun.
Oh, yeah, I know when we share what we do, it's unbelievable how much we have going on, but it's very exciting, like all the different topics, all the different presenters, the hands-on, the live. We're so fortunate, you know, that we have the capabilities to be across Canada with the live streaming, and then having, you know, even with the myofunctional therapy, we have people coming from Saskatchewan, Manitoba, it's British Columbia. It's very exciting days.
Well, I
Very
want to say a
exciting.
big thank you from all of us, for both of you for joining us today. It was a pleasure to spend the last hour with you, and it did go by very quickly. So thank you for all of your knowledge, putting yourselves out there, and to the rest of the RDHU crew. I'm so excited to be on this with you. We look forward to seeing you guys in October with our next show. And I hope everybody has a lovely weekend, and hopefully it's not too cold for you, Liisa, but we will enjoy some slight sunshine and maybe some tank tops. Okay.
Yeah.
It's supposed to be warm here. It's still, like I said, it's still sunny, and it's in like the 20s, 19, 20s. So it's still nice here. I'm not that far north, but we don't have snow yet.
That's good.
Well, good to see you all. Thank you to everybody who's on with us. We really appreciate you being here with us.
Thank
And
you
thank
so
you,
much.
Liisa. It was great.
Have a-
Another great one.
Thank you both. Another great one.
Have a great
All
week.
right, ladies.
I'm off to do
Have
a
a great
shopping course.
weekend. Yeah.
Have a good weekend. And happy birthday, Liisa.
Birthday,
Happy
Liisa.
birthday.
Ladies.
Bye.
Bye.